Welcome back to FAMWISE, lesson number 5 in biomarkers. We're going to be covering what to look for in your cervical mucus and how to actually observe that. So let's just do a quick review on why we're actually charting these biomarkers. Remember, these can give us so much information about our hormone health and our general health. And by charting these, we can recognize the signs of approaching ovulation and create a personal health history record. Cervical mucus is one of our primary biomarkers to determine fertility for any given day. So when we see cervical mucus, we know that the cervix is open and it can let sperm in, and it can keep sperm alive for up to 5 days when we are fertile. Remember, through the fertility awareness method, we are identifying our fertile and infertile days, which is also known as when the cervix is open and when it is closed. So let's do a quick symbol recap. So remember, our menstruation is charted in red, and we have our charting symbols: H for heavy, M for medium, L for light, and S for spotting, and B for brown. And then we have our dry days charted in gray. The symbol is G, and we can see that after your period, and then we can also see that after ovulation. And when you see those dry days, it means you are infertile. And then we have our E mucus days. We have a light blue for EL, which means rising estrogen. This is your moist sensation. And then we have ES for stretchy, clear, slippery, very fluid, and lubricative. That one is our dark blue, and this represents high estrogen. And remember that peak day is the last day of any ES mucus. And then we have our yellow there at the bottom, which you can chart if you see a confusing observation. Maybe it's pasty, sticky, or unchanging. And then make sure you write good notes about what you are exactly seeing so we can determine better what it is. And then always, if you see any bleeding or E mucus along with that, you can chart that as well. We can see how the mucus applies to our chart. So at your period, you get the red bleeding, and then right after we can see our G days, and then we move right into EL, and then this usually increases up to that slippery, clear, lubricative ES mucus, and then after ovulation we get our G mucus again. Now you can see E mucus at the end of your cycle, right before your period. Once you've confirmed that ovulation has taken place, you're not going to ovulate again until your next cycle. So that E mucus that you might be seeing right before your period can be because once your hormones drop and your cervix is opening up to allow the blood to come out, then you could see a bit of that mucus. And then also the fluctuations between progesterone and estrogen, you might see a little bit of mucus there as well, especially if you have higher estrogen and lower progesterone. Another pattern that is really common is going from your period right to EL or ES, so your point of change, and skipping the G between your period. So especially if you have a short cycle, you could get like a mixture of mucus on those light days of bleeding. So you need to make sure that you're checking, if you have lighter days at the end of your cycle, that you're checking for mucus on those as well. And here is our example client chart without the BBT. So it's just charting mucus qualities. You can see how we have our menstrual bleeding at the beginning, and then we move into G days. We have our EL mucus swiftly moving into our ES days with a stretchy, clear, lubricative. And then after ovulation has taken place, we see those dry days again, and then she does have a little bit of that E mucus at the end of her cycle as well. Now, before getting into what we're going to be seeing with the mucus and stuff, we're just going to go over the symbol recap a bit more thoroughly just to really ingrain it. If you want to skip over this, you can, but I do recommend listening to it again. So our EL is light blue. This is a moist sensation, and this reflects that the dominant follicle has been chosen and an increase in estrogen is noted. This progressively becomes more fluid, clear, stretchy, slippery, and abundant as we move into our ES mucus days. And then this also may be the point of change that you're seeing from the end of menstruation or those dry G days. So remember that EL represents a moist sensation. So you're not seeing anything, you're not looking at what you're seeing, but you're just noticing that you feel moist down there. So if you are seeing anything, this could be because it is mixing with G mucus. So after your period, the residual progesterone from the last cycle can cause the cervix to make that G mucus, which is going to plug it so it can't let any sperm through. Once we see the rise in estrogen, this G mucus can start to come out, and that might be what you're seeing mixed with the moist, and this would be fertile. ES is your dark blue days, and it is used for stretchy, clear, lubricative, fluid, or abundant mucus observations. This represents that you have high estrogen and are swiftly approaching ovulation, and you can use the symbols when you're charting. So when you chart the dark blue and your symbol for that, ES, You can also write S for stretchy, C for clear, or L for lubricative or slippery in the notes section below, just to make sure that you are writing down what exactly you're seeing. And then also you can write how much as well. So if you want to write a little bit, maybe I saw a medium amount, or I saw a lot. E mucus, they are both fertile, so EL and ES can both lead to pregnancy. Both represent that estrogen is increasing. EL means low estrogen but rising. ES is high estrogen, and then both mix together to keep sperm alive by changing the vaginal pH and filtering out malformed sperm. So you're going to find them together, but whichever one is dominant is the one that you're going to be seeing. We use G and gray for our dry days, and this is experienced as a dry sensation. You might see thick, cloudy, dense mucus, which can detach from the mucus plug. And after your period has occurred, residual low levels of that progesterone from the previous cycle can stimulate that dense mucus that fills in the cervical canal until estrogen rises again. And that is experienced as dry. Now, we said in like a couple slides ago how you might see that kind of thick, cloudy, dense mucus mixed with moist, and that can happen once that G mucus that was filling in the cervical canal falls out a little bit. So if you do see that moist, you need to chart that as EL, and that would be a fertile day. But sometimes we can just see like cell slough or like a little bit of that G mucus without that moist sensation. You can chart that as G and it would be infertile. And yellow is our confusing observation. So you can chart yellow when you see a confusing or unchanging observation. So if you see sticky, pasty, gummy, or that unchanging mucus. So let's say that you're getting something that you just don't really recognize and it keeps coming every single day for you. So that's unchanging, like it's been a week and you're still seeing that, then you can write yellow, and perhaps we need to see if there's some sort of infection, or maybe we're just unclear on what we're looking for. So it's neither a dry nor a clear sign of estrogenic mucus. You need to write why it was confusing, what you see, and if EL or ES or bleeding occurs along with that, you need to chart those as well. Yellow is considered fertile, and it might be the POC until a pattern is established. So later on, once the pattern has established, then we can upgrade this to either an EL or downgrade it to G, depending on what we are seeing. But when you're first starting to chart, treat yellow as fertile and then see what happens the next day. So here's an example of a yellow day in action. So yellow before EL can be normal and a part of your basic infertile pattern, so your BIP. And eventually we could upgrade this to EL. It might be that G mucus mixing with EL mucus, and that is why it might be hard to distinguish, resulting in that yellow day. So you can see on the first diagram there how we have 2 yellow days, a light blue day, and then we go into our ES dark blue mucus days. The first yellow day could be considered our POC. So we're kind of unsure on what we are exactly seeing. So we write this might be a possible POC. The next day we have yellow as well, and then we go into EL and then ES. So likely that was the G mucus plug coming out as the cervix started to open, which we considered fertile. So then technically that first yellow day would be the POC, and we could technically upgrade that to an EL day. And perhaps it was moist as well. So the second diagram, we have a dry day and then we have the yellow day. And again, we might be this is our POC. We're kind of uncertain on what we're seeing. The next day we have a dry day, and then the following day we have a dry day as well. And then following that we have an ES day, and then that increases likely towards ovulation. So that first POC, the first yellow day there, that would not be considered our POC because it was not increasing in like mucus quality. So we didn't switch to an EL day, we didn't switch to an ES day. It was just 2 dry days in between. So our true POC would be the second one there, the dark blue ES day. So that's your tip here. So a true POC will progress to a highly estrogenic ES mucus in hindsight. Remember that yellow observations might be due to normal cellular sloughing or secretions from the vagina, cervix, endometrium, and this is like the cleaning mechanism, and it's very normal and healthy. It could be due to cellular proliferation from constant low level of estrogen. So if your ovulation is delayed or you have really long cycles from PCOS, things like that, it could be from that. And then also if you have inflammation or some sort of infection, that could be causing that as well. I feel like you guys are starting to get it with the colors and the symbols. So if you want to give this a read, just give it a pause. And again, if you want to go over this chart, just give this video a pause as well. We're going to take a quick break. You guys can look at this. Now we're going to be going into the type of mucus that you could be seeing. We'll do a video demonstration, and there's some pictures there as well. So how do you go about observing your mucus throughout the day? There is two basic ways: internal checks and external checks. Now, internal checks can cause a lot of confusion, and you will never really have a completely dry day because, again, our vagina is a mucus membrane, and it can be difficult to determine if mucus or you're seeing vaginal cell slough. And also, it might introduce bacteria by doing those internal checks. And this is why we recommend those external checks, because it can be easier to determine. Obviously, when you're checking cervical position, which we haven't gotten to yet, you are going to have to insert. So you can check for mucus when you're doing that, but we'll go over more of like the details and the rules around that. Here's how to actually observe and chart your mucus. So you're going to be doing this every single time you go to the bathroom. It really becomes a habit and you get quicker and quicker at it every single time. So grab your tissue, fold it in half, and then you're going to wipe front to back, always front to back, so that you don't introduce any bacteria. And then you're going to check for sensation first. So as you're wiping, check for that sensation on the perineum. Again, your perineum, if you're looking at that picture on the right, the pink one, the very bottom of that picture is where your perineum is. So it's kind of like by the end of like the opening to the vagina and then the anus. So like it's kind of between there. It's a really soft piece of skin. And then when you wipe, you're going to feel, does it feel dry? Does it feel like slippery? Does it feel like it's smooth? And that is your sensation. Next, you're going to look at the toilet paper to see what you see. Look for quality and look for color. Does it look like it's dry? Does it look like it's moist? Do you see any mucus that you can possibly pick up on there, or is it just like a shiny? Next, you can touch it, so you can squeeze the tissue paper together and then see if anything like stretches. See what it feels like. Does it feel lubricative? If you really want to, you can touch it with your hands as well. Might be like a little bit easier to determine. And then the last part is that you can just record what you see, and then make sure you're recording at the end of the day the most fertile sign. You can record like what you're seeing each time, like in your phone or on a notepad, and then on your chart, you're going to record the most fertile sign of the day. So we want to observe frequently, and again, this becomes really second nature and you can do it pretty quickly. You want to be attentive to the sensation while going about your day. Observe when using the bathroom, before you go and after, and then you can also look what's on your underwear. The gravity and movement of the day and the gentle bearing down, if you're going like number 2, will bring mucus forward, so it might be easier to see that as well. And then observe after exercise and bathing, observe at bedtime. So when we are using the mucus that we see on our underwear, you can chart this, but you can't chart this at the same time. So we want to really use the toilet paper method and kind of notice what is coming out. But when you're looking at your underwear, this can get confusing, and that's why sometimes we don't like to chart directly just from what we see on there. This is because you can have vaginal cell slough in your underwear, and it's not uncommon to see like that creamy or crumbly discharge on your underwear as well. If you see peak mucus, like you see like discharge that is stretchy, it's clear, like it's a clear sign that this is ES mucus, go ahead and chart that, because the only time we're going to be making that is when we're in our fertile window. So you can chart that just on your chart. Otherwise, whatever other observation you're seeing in your underwear, you can just put that in your notes. So this is going to be especially important for beginners, because the beginning of charting, it's really easy to confuse that vaginal cell slough and mucus. And then you can eventually at the end of your chart see like what you've noted, and then really see like whether or not it was actually dry, and if it was cell slough, or if it was indeed that EL or ES mucus. And on an EL and ES mucus day, you will see the difference and feel that moistness. How we are observing, we're always wiping from front to back, and we are wiping across the perineum, because that can help determine the sensation. You can see on the bottom of that picture, that is where your perineum is. And again, we are only doing external mucus checks, because if we do the internal, it can get really confusing with like the moistness. So let's go over a couple different mucus observations that you can see along with some pictures. So for a dry day, you can get that thick, cloudy, densey, or tacky type of mucus. You may observe nothing, and you also might observe absolutely nothing. Maybe just like a little bit of wetness on your fingers. If you do like kind of touch down there, you might notice slight moisture, similar to touching the inner part of your cheek for a second. So if your fingers have that dampness, usually this just evaporates within a few seconds, and that's very typical of the vaginal opening with no cervical fluid, and this is charted as G and would be infertile. If you see that sticky, pasty, or gummy mucus, now what this looks like is going to be very unique to you, but you do see some sort of cervical mucus that you are uncertain on what it is. So it might be sticky like glue, pasty, or gummy, or just that unchanging mucus. So day to day, you keep getting whatever this mucus is, you're unsure. Maybe it's like very white like cottage cheese, maybe it's yellow, that would be indicative of a possible infection. So you're going to want to write that down. It could be flaky or rubbery. And the main point that it's not moist. So if it's moist, write that as an EL day because likely that is fertile. If you're getting like that moist sensation along with like a confusing mucus, write down yellow as well, write down what you see in case it is an infection. The next type that we see is that creamy or lotion type mucus, and you may notice this for several days. It's a wetter type and it might even stretch to like 3/4 of an inch and then break. It is wet, but it's not quite the quality of egg white mucus, so it's not clear or stretchy. And this usually is a transitional type of mucus, which then progresses to more ES qualities like clear and stretchy. And this is charted as ES. So if you get that creamy lotion type and it's lubricative, so because it is lubricative, it is charted as ES. If you're seeing a cloudy, stretchy mucus, that would be charted as ES as well. So even though it is cloudy, because they're stretchy, it would be ES. Now we can see that egg white mucus. Usually this is the easiest type to identify because it resembles raw egg whites, and you've probably heard of this one before. So it stretches at least an inch and it doesn't break when you stretch it. It is clear or has a lubricative vaginal sensation. You might even see a little bit of yellow, pink, or red streaks in it, which can possibly indicate ovulatory bleeding. And then this can also be so watery that you can't actually see anything, but you can only feel a slipperiness as a sensation. So some women don't get that egg white stretchy, or they skip over it, or they just don't notice it. They may only get that really watery fluid, like possibly like a watery gush. That would be indicative of high estrogen as well and would be fertile. This type of mucus also leaves a fairly symmetrical circle fluid in your underwear due to that really high water content. So if you're looking at your underwear and like that just kind of helps you determine what you're feeling with the toilet paper, you might see like a circle of just like wetness. If you're seeing more of like a streak, like in the picture down below, that might just be some vaginal cell slough. You can clearly see that there's not really much moisture to it, and that can help determine what you're seeing. So what if you never see any mucus? I would be asking, are you checking enough? So are you checking before and after going to the bathroom? Post bowel movement and exercise as well can really bring it down. So perhaps try then. And then throughout the day, really paying attention to that sensation. So are you walking around through the day? Do you feel really dry down there, or do you feel like you're a bit moist? So pay attention to that. And then if you're still not seeing any, I would be asking, are you or were you on a hormonal birth control recently? Because after you get off, it can take a little bit to kind of get that mucus flowing again. If you're on birth control, that can affect it as well. Have you had HPV or like any cervical dysplasia, any surgical procedures on your cervix? That can affect that too. Are you currently taking antihistamines for allergies? How is your hydration? How is your nutrient status? There's also age relation as well. So the older we get, sometimes we can see less and less mucus. So maybe you were getting like 4 days of ES mucus when you're younger. And as you get older in your 40s, maybe you're only seeing like 1. And then also I'd be asking, is there some sort of hormonal balance? So in a healthy woman, the cervical mucus really should be fairly obvious. If you aren't seeing anything, but you're still ovulating, long-term use on the hormonal birth control can contribute to low or no cervical mucus. Gradually, this should improve and is temporary, but also could be generally less the longer you are on hormonal birth control. So we want to restore nutrients that support hormonal health. And then also we need to check into hormonal imbalances as well. So perhaps you're actually not ovulating, having functional hypothalamic amenorrhea. A hallmark symptom of this is absence of menstruation. So you're not getting your period, and then hormonal levels are low. So you might not be seeing any cervical mucus as well, or just like a low amount. Another really common question is, what if I always see mucus? So this is referred to as a continuous mucus pattern, and you would chart yellow if you notice unchanging mucus from day to day, along with any bleeding or EL or ES qualities. And this could be related to something like a yeast infection, bacterial vaginosis, excessive histamine production due to allergies or food sensitivities, or a hormonal balance such as PCOS leading to irregular cycle patterns as your body attempts ovulation. So if you have PCOS and those long cycles, perhaps you're seeing mucus mucus patches when your body tries to ovulate, but it doesn't. So then you get G mucus again, and then you get more E mucus, and it's just a cycle of that until you actually ovulate. In some cases, excess constant discharge, especially that very watery discharge, it could be an early warning sign of cervical dysplasia. Having watery mucus around ovulation is normal and can represent that high estrogen. But if you are getting it cycle long, that's something to look into as well. Now, we also want to chart our symptoms. So fluctuating hormone and health issues can cause other symptoms throughout your cycle. So you could have pain, headaches, fatigue, insomnia, weight gain, bloating, acne, mood swings, irregular cycles, and fertility challenges. So the severity of these symptoms can differ per person and their lifestyle, diet, and environment. So any symptoms and other notable life factors should be noted on your chart in your notes section. And this could be stress, illness, medications, travel, or weight changes. Welcome to my kitchen, you guys. We're going to do a cervical mucus demonstration. So we're going to go through the different types that you might be seeing and exactly what they mean. So we're going to go through the dry, the EL, and the ES mucus. So starting off with the dry mucus, you could see this after menstruation and then also after you ovulate. So when that progesterone is rising, that means we are creating that thick, dense cervical mucus. So then that's going to plug the cervix, and you might not see anything at all. So when you wipe, you could just get a little bit of shininess and it quickly dissipates. Or it's also possible to get this kind of tacky cervical mucus. Usually this would be a little bit of the G mucus plug, or it could be cellular slough just from your vagina's cleaning mechanism. So that is something similar to what you might be seeing. Also notice that it's not moist. You have no moist feeling. It's definitely not stretchy. It's not clear, and it's definitely not lubricative. So that would be a good example of a dry day. Now, another example of a dry day is just a slight wetness or shininess on your hand. And again, if you just kind of let it rest in the air, it's going to quickly dissipate. Over time, you will notice the difference between when you are fertile and when you are not fertile. And really the different mucus observations that you are going to notice is going to be different from another person. But in general, this is what it is like. So oftentimes when we go from our period to dry days, eventually we escalate to our fertile window, which we notice this creamy or lotiony type of cervical mucus. And again, it is possible to go right from your period right into the fertile window, and sometimes your mucus can even overlap your period. So you really need to be paying attention if you have a short cycle especially. And even if you have regular cycles, it is possible for your cycle to change every once in a while just due to stress and different things. So if you have a regular cycle, it could become short randomly one time. And then also if you have a regular cycle, it could be longer sometimes, maybe ovulation was delayed. So it's really important to chart down exactly what you see. If you've been charting for a little bit and you keep having these regular cycles, and let's say it's right the day after your period, usually you're dry, but you see this lotiony type, or you see an E quality type of mucus, you need to write that down and you need to treat it as a fertile day, even though it's not usually a fertile day for you, because it's definitely possible for your cycle to shorten. I've had cycles where I ovulate mad early compared to regular ones, and I'm glad that I followed my body's biomarkers and what it was telling me, so I didn't have accidental intercourse on that day. So when you're wiping, or if you put clean fingers down there, you could notice this lotiony type of cervical mucus. So it is white, so it's opaque, it's not clear or stretchy, but it is lubricative. So this would be considered fertile mucus. And then you can also see this type of mucus with extra fluids. So still white and opaque, but it's really mixed with some clear fluid stuff as well. So this would definitely be fertile as well. And also note that some people will refer to mucus as not as fertile or more fertile. And sometimes we use the terms peak mucus and non-peak mucus. So even if you're seeing this type and it's not that hallmark, clear, stretchy, lubricative, this can definitely still get you pregnant, and this is still considered fertile. There's not really a more fertile or less fertile type of mucus, because you can't be more or less pregnant, as Lisa Hendrickson Jack likes to say. Now, as we progress through our fertile window, you can get a stretchy mucus that is still white. So this one stretches a little bit, but it's not stretching that much. So let's just say that is stretching quite a bit, just because my products here aren't really working that great. So if it is white and it's stretchy, because it is stretchy, it's considered ES mucus. Remember that the signs of ES mucus are stretchy, clear, or lubricative. So any one of those, that would be classified as ES mucus. Now when we're classifying EL mucus, you might just feel a bit more moist down there than usual. So remember, we're not really looking for anything physical, but you just feel moist. Because remember, during our dry days, we have that dry, so you might see a little bit of something, but it is dry. It's not moist like you're feeling when your estrogen is starting to rise, so that would be the difference between dry days and moist days. Now, as we progress through our fertile window, you could see that clear, stretchy, lubricative type cervical mucus. This is like your classic egg white mucus, so it is stretchy. My product isn't stretching that well, but you could get a stretch up to about that far, and it doesn't break. That's kind of like a hallmark of like the clear egg white stretchy mucus. So you could see mucus like that. See how it's like stretching. And then again, yours can stretch even further and it doesn't generally break. So that would be considered that ES mucus. So even if this was white and it's stretching, it's still stretching, so it's ES mucus. Again, like we saw with the lotiony type, it wasn't stretchy or clear, but it was lubricative, so it's still ES mucus. Now, another type of like cervical mucus that isn't really talked about that much is like this like super watery type. So you might be the type of person that doesn't get a lot of stretchy mucus, or maybe like you skip over it, you don't really notice it, but you have these really fluid days where like you feel kind of these gushes coming out. That is still highly fertile and represents high estrogen. Now, the amount of cervical mucus that you get personally is going to differ from anybody else. So some women get a lot of cervical mucus, some women just get a little bit. So this is really going to differ per person. And again, the best way to learn is just to start charting. So just get in the habit of check before you go to the bathroom. After a bowel movement, you could check again throughout the day when you're walking around. Just notice how you feel and then chart the most estrogenic sign you see at the end of the day. Chart as best you can. Just start to notice like the different mucus you're seeing. If you really want to, you could take pictures. Some people find that helpful. And if you find this overwhelming, just chart like the sensation to start. Chart if you're feeling moist. Then you can start charting like different physical things that you see, because that's going to be the best way you can learn. So mucus to watch out for: if you have any like pretty yellow mucus, green, gray, if you're getting that cottage cheese type mucus, this could be a sign that you have a vaginal infection, so please get that checked out as well. Another great resource is cervicalmucus.org. This lovely lady has put up a bunch of different pictures and videos about different cervical mucus. And if you really want to, you can submit your own. So this kind of just helps you identify what you're looking for in the different types. So that can be helpful for you as well. As always, if you have any questions, post them in the community. If you want me to go over any of these further, just let me know. If you see these, you need to be using protection if you do not want to get pregnant. And if you do want to get pregnant, now is your time. We're going to go over some mucus types that would be considered fertile for you. Now, first up, we see this lotiony type. Now, this isn't considered peak mucus, but it's still fertile because it is lubricative. It's not clear or stretchy, but it's lubricative and it's giving us that moist sensation. This can get you pregnant. A lot of times you might see a really fluid mucus mixed with the white, which kind of looks like that, like you've seen in my other videos. And that can occur as the rising estrogen is leading you towards ovulation. This is considered fertile. Now, as we progress through our cycle and our estrogen is rising as that follicle grows, we're gonna get a more clear cervical mucus. So it's lubricative, it's clear. It stretches a little bit, but it's not really stretching that much. This one would be considered fertile as well. As we get closer and we're nearing ovulation, you can get that egg white, stretchy, clear, and lubricative type cervical mucus. This one is very common. Now, some women get a ton, some women just get a little bit. This is considered fertile. Another option is you can get that stretchy mucus, but it could be white. Maybe it's not really clear for you. Maybe it's a mixture of clear and white, but this is still considered fertile because it's stretching. The other option, and a less known one, is this really watery like cervical mucus. Now, you could have that mixed with either the stretchy egg white or more of the white opaque mucus. And this one is suggesting really high estrogen, and it could just be watery for a lot of ladies. Might not get that stretchy sensation. You could skip over it, or maybe you just don't notice it. This is considered fertile. So we covered the different types of discharge that you might be seeing. So when we were deciding between our fertile and infertile days, we look at our cervical mucus. So we went over in the other video the different types of fertile mucus that you could see. So if you're not trying to get pregnant, you would use protection or abstain there. And then if you are trying to get pregnant, that is your time. So the days that you would be deemed like infertile would be our dry days. And this can look different person to person. In general, you are feeling dry. You're not always gonna feel super dry down there. It is a mucous membrane, remember, so it's gonna have a little bit of something. So if you were to have clean hands and insert, you're going to get something, and that's why we prefer external checks. So after your period, you can get a handful of dry days before your body starts to make that cervical mucus as your estrogen rises. And what this looks like, again, it's gonna be different per person. You might have this like dry, tacky discharge. And notice how it's not clear, definitely not stretching. It's certainly not lubricative. So this has like not much moisture to it. If you rub your fingers together, it kind of balls up and it's definitely dry. And again, we're not having that moist sensation down there. It also might just look like that, just like a little something. And what that little something could be is like cellular slough from your cleaning mechanism. It also could be G mucus from the residual progesterone from your last cycle as well. Another thing you might see on a dry day is just a little bit of like moisture. But really the air is quickly dissipating it. It's not lubricative at all because remember it's a mucous membrane, so you might get a little bit of like wetness. You might not feel completely dry, that's completely normal. So you might just get a little bit of like shiny or like wetness on your finger. And then with your toilet paper, when you wipe, you could see a little shiny spot, and that can be completely normal as well. It can take some time to kind of dictate between a dry day and your fertile mucus days, but with practice and over time, you will get the hang of it. Just take your time with it. Maybe just look for like sensation, get in the habit of checking. And you can move into charting like different things you see, whether it's like lotiony, lubricative, if it's clear or stretchy, or if you're getting those dry days. It can really speed up the process and make you feel a bit more confident if you do work with a fertility awareness instructor or if you take a course. I do have a free FAMWISE guide in my bio, so you can check that out. And I have a course launching soon as well, which I'm super excited for. So stay tuned for that. And you've made it to the end of the lesson. So I hope that video was helpful in helping you determine exactly what you're looking for when you're looking at your mucus and how to do that, how to chart. The homework for you guys today is to just start charting. And if you feel overwhelmed or confused, this is a very normal stage, and nobody learns just by reading a book or watching a video. You'll really learn just by doing. So just start by getting to the habit of checking for cervical mucus, and then you can determine the sensation, and then eventually determine the differences that you can see in these mucus observations, and then come back and watch this video again, and you'll see that you'll have a better understanding of like the content. And that is it for this lesson. In the next one, we're going to be covering the phases of the cycle.